Welcome to this presentation on the fourth year and first year community pharmacy visits. On behalf of Professor Guckert and myself, we want to thank you in participating in this activity that we find is so valuable for the first year pharmacy class, and I know it's been enjoyed by the previous fourth years that did participate. The point of this presentation is to introduce the activity outcomes to you and also to provide you with some support and some examples on how to achieve the activity outcomes. I'll also share with you why this experience is so important to the learning of the first year pharmacy class. So the activity outcomes include discussing pharmacy as a profession. We've been discussing pharmacy as a profession since September, but it's always nice for first year students to hear about pharmacy from someone else besides me. We want to explore the provision of patient care in the community pharmacy setting. Please keep in mind that this may be the first time a student is seeing the pharmacy behind the pharmacy counter in a community setting. So everything may seem very new or overwhelming to them. We want to demonstrate how professionalism informs patient-centered care. Being in fourth year now, it's quite obvious to you that there's a clear link between professionalism and patient-centered care. And we'll discuss what's the best way to mentor this topic with the first year pharmacy student. And lastly, Professor Guckert and I want to provide you with an opportunity to mentor a junior colleague. Part of being a professional and being part of a profession is to contribute to the knowledge, growth, and education of your colleague. So this is an opportunity that definitely supports this outcome. So I just want to give you a background of how and where this activity is situated in the first year curriculum. So right now, the first year students are enrolled in Pharm 342, which is a drug use process and patient care module. Do you remember all that jurisprudence material that I had you work through and those labs that seemed so difficult a couple of years ago, but they probably seem so easy now? Well, they've been in this course for at least 4 to 6 weeks, okay? They've been exposed to PBL learning on jurisprudence and patient-centered care. So what they've been doing is, after we have some lectures, then they're broken up into seminar groups where they actually work through some of the cases that are based on the legislation that we've discussed. Some of our students may have already started some practice labs, so they may be a little bit comfortable on Kroll or understand how Kroll works or how prescription processing works in the real world, but many of them are not comfortable with this yet. This activity is mandatory attendance, and they must complete a self-reflection on their visit after their visit, and that will be definitely graded. Okay, I have sent you the assignment link as well that you can review if you want a little bit more understanding of what the students will be writing on. I just want to emphasize the importance of maintaining patient confidentiality. Prior to going to the visits, this will be discussed with my first year class, and it will be reinforced, so not to worry there. But if you do suspect a breach or a lack of professionalism in this area, please don't hesitate to call me or email me, and I'll provide that information to you in an email. I will have my cell phone on during the time of the visits. Also, some sites require any visitors to sign a confidentiality agreement. So if that is a policy that you have at your site, if you could double check, that would be great, and prepare those documents in advance. I know Safeway used to do that when I was working at Safeway. Next, we'll discuss the timeline. So this activity is 90 minutes in length. I do want to make sure we use your time effectively and efficiently. I realize you have many things to do while you are on rotation. So if a student arrives late, please make note of it, and please do not hesitate to email me because this shows me a lack of professionalism on their part and a lack of planning, and I do want to address that with the students. So the first 10 minutes is reserved for the arrival of the students as they make their way to the pharmacy. If you have a designated spot where the students can place their jackets and their bags or purses, please point that out to them. If you do not have the spot, that's completely okay. Just ask the students to carry around their belongings. During this 10 minutes, please take some time to introduce yourself and introduce your pharmacy team members. The next 20 minutes is a pharmacy tour, and you may want to point out some key features of your pharmacy. This may include the OTC and self-care area. It may include the private patient counseling area, the dispensary compounding area, or any other features that you feel are unique to your practice site. You may also want to discuss the role that each pharmacy team member plays and describe any clinical services that the pharmacy provides or specializes in. The next 15 minutes are reserved for prescription processing. Please keep in mind, I do not want you to show this process to the students with a real patient or with a real clinical scenario. We just want to make sure we maintain patient confidentiality. So what I would suggest is either creating a mock patient in your computer software, or you can even role play with one of the visiting students and have the other students observe. So during this prescription processing, describe the workflow that supports patient care activities and prescription processing. So you may want to take them through accepting, filling a prescription, dispensing a prescription, packaging a prescription, and then counseling as well. You may want to also show the dispensing software to the students. Do not go into detail, obviously, but you could point out key features on your software and show the students a sample patient profile. And point out any key features that you think are useful. The last 40 minutes are reserved for your discussion. It's important that you discuss the primary question that the students in first year are expected to write about, and that is patient-centered care and how professionalism impacts patient-centered care. The best way to discuss this question naturally is to share one of your personal experiences in pharmacy practice or one of your patient care experiences. I'll show you how to do that in the next couple of slides. I'll share one of my stories with you. You may have some time left over, so feel free to include additional discussion questions. Some of the feedback from last year suggested that it'd be nice if the first year students came with a prepared discussion question. I will definitely take that suggestion into consideration and ask my students to prepare a question for you. The last 5 minutes is to say goodbye and to wrap up anything that's outstanding from the visit. I do want to emphasize, if you notice any lack of professionalism amongst our students, please do not hesitate to contact me. I will have my cell on during the visits, but you can also email me as well, and I'll provide that information to you in a follow-up email. This slide is the exact reflection question that the first year students will be writing on. Describe an event, activity, or observation that represents to you the concept of patient-centered care and discuss how this helped you come to a better understanding of how professionalism informs or guides patient-centered care in community practice. I also have some prompts in the self-reflection assignment that helps them look at this topic in different ways. The subpoints included are: what new questions or understanding of professionalism have come to light based on your experience? Did this experience further your holistic understanding of professionalism? And suggest a relevant, specific, and feasible way to apply what you have learned to a future situation, i.e. their Pharm 305 rotation, which is their community rotation after first year. Now I want to specifically discuss how to achieve the activity outcomes, and I want to provide you with some support and examples to help you foster these learning outcomes. So the first outcome I discussed was discuss pharmacy as a profession. So this may include a discussion on interprofessionalism and an IP-based approach to healthcare. You could discuss things like, well, does your pharmacy foster this type of relationship? Do pharmacy team members have relationships with other healthcare providers in your community in order to provide care? You could also discuss any of your other experiences regarding interprofessional healthcare. You could also discuss current topics in pharmacy practice. That may include the fentanyl crisis in Alberta. It may include inducements. So we did discuss inducements in October, but it would be nice for them to hear your opinions on inducements. You could discuss medically assisted death or any other topics that you feel are relevant. In terms of professionalism, you could also talk about the breach of professionalism. Unfortunately, the ACP website has quite a few case studies on how our colleagues have breached ethical standards or professional standards, and so that might make for an interesting discussion. In addition, you could also talk about continued learning and professional development. You could discuss specialization or the additional credentials that some pharmacists may have, or even some of the opportunities that you're interested in order to shape your practice. The second outcome is to explore the provision of patient care in the community pharmacy setting. This outcome will be achieved by you taking the students on a tour of the pharmacy and discussing workflow with them. And once again, I do want to emphasize that it's beneficial if you do mention the services offered by your pharmacy, whether that's flu clinics, whether that's specialty compounding, or even where you do perform medication management reviews. Also, I want to mention the importance of you taking the students through a prescription fill and dispense cycle. This provides context to those students who haven't had a chance to work in pharmacy yet in regards to all the legislation that I discuss in Pharm 342. Another major outcome that I'm hoping that we can achieve through this activity is to demonstrate how professionalism informs patient-centered care. So being in fourth year, it's probably quite apparent that professionalism and professionalism behavior and traits are related to providing exceptional patient-centered care. So I'm hoping to bridge these concepts for the first year pharmacy students as well, and hopefully you can help me do that. The best way to do this is to use a story to demonstrate this experience. I'll share my story with you that highlights various professional traits and how that inform patient-centered care. But before I do that, I do want to give you some ideas on the professionalism, behavior, and traits that the first-year pharmacy students are aware of. So if you look at this next slide, it's a summary of the behaviors or traits that are discussed in your experiential manual and also are apparent in the lab manuals, the skills labs manual. So what I've noticed going through various literature on professionalism, that individuals may group them differently. However, the fundamental traits, as listed on the next page, are usually the same. Okay, so the story I'd like to share with you is the one where I was caring for a patient who had severe mental illness, major depressive disorder, and I had known her for quite a few years. Our entire pharmacy had known her for a couple of years, and she was a teacher and a mother of 4. And the years that I had known her, she had really struggled to get a medication regimen and a healthcare professional that was attentive to her needs and willing to be proactive and be a partner in terms of her achieving her therapy outcomes. So for the most of the time I did know her, she was struggling with depression. She was not able to work, not able to care for her kids in a way that she wanted to. But finally, she had finally been paired up with a psychiatrist who was very attentive to her needs, and she had been put on a new medication regimen. So all her medications has changed. We had blister packed them, and it was only enough supply for 1 month. And upon discussion with the patient informed me that the psychiatrist would like her to follow up with the psychiatrist prior to her next fill. So she would receive another prescription, and we would then go on and blister pack her medications based on if we were going to keep medication the same or make any changes. That would be notified at that time. The problem was this appointment was quite close to the Christmas break, and unfortunately my patient missed following up with the psychiatrist, and there's a loss in communication. And probably around Christmas Eve or so, she came and saw us, and she was quite flustered and panicking that she wasn't able to get a hold of her doctor. They had closed the office for the holidays, and she had unfortunately missed her appointment due to an unusual circumstance. And she would not have enough medication to last her the next 4 days while the office was closed. So there were some benzodiazepines in her medication regimen and various other medications. In that case, the option I had was, well, I couldn't get a hold of any prescriber, and there was no psychiatrist on call that I knew of at that clinic. So I did try to call, and there was no further information. Second, I could send her to the emergency department for assessment. When I brought that up to her, she was quite overwhelmed and frustrated and was getting more anxious. And the last option was I could give her medication to carry her through the next 4 days until I or her could follow up with her psychiatrist. So at that time, I thought I'm going to prescribe her therapy. I assessed her therapy. asked how she was doing, if the medications were working as is, if she was experiencing any side effects, any concerns that she wanted to disclose to me. She actually was doing really, really well. She was very happy with her medication regimen, and that's why I think she was so anxious to not have any medications for the next 4 days and perhaps relapse and have to start all over. So I decided to prescribe all of her medications, and that included the benzodiazepine she was on. So before I did that, I discussed this with my colleague, another pharmacist that was working with me, and she was dead against me prescribing a benzodiazepine. And I felt that I did not want to play around with her regimen or prescribe the other 6 meds she was on and then not prescribe her benzodiazepine that she was taking regularly as part of the regimen. So my colleague was not willing to support me and didn't want anything to do with that scenario. So I had to make that professional judgment on my own. I did decide to prescribe the medications, including the benzodiazepine, blister packed everything for the next 4 days, told her I would follow up with the psychiatrist myself as well, because I do need to notify them in terms of what I have done with your medications, and asked her to follow up with the psychiatrist as well. So she was happy with that, and what happened was the 4 days that passed, the office was going to open and I was not scheduled to work. But I knew it was important to have a discussion with the psychiatrist because I needed to take ownership of my decision. So I did come in on my day off and made a point to call the psychiatrist and debrief him on what I had done. Thankfully, and it makes sense, the psychiatrist thought it was natural and common sense for me to continue therapy based on what I had done and assess the patient. And he was very thankful. And so that was great, and it validated what I thought was patient-centered care. The patient did end up following up with the psychiatrist and did get a new prescription. So that story to me demonstrates patient-centered care and various professionalism traits. So you could ask the first-year students, after you've shared your story, to have them pick out the traits that you feel you exemplified in your story. So in this case, things like accountability. I took accountability for my actions. I did not delegate contacting the psychiatrist to another colleague or another pharmacist who maybe would be uncomfortable with what I had done. I also made sure I followed up. I practiced empathy. I did not want to cause further distress to the patient by sending them to the emergency room on Christmas Eve, so they would have to be away from their family. So I decided to bridge therapy until they could see their prescriber. I was also putting the patient first. One of the first ethical principles from the ACP is put your patient first, and I felt like I was doing that as well. And there could be various other traits that are exemplified in this story, but have the students pick that out for you. If you have any questions, definitely give me a call and I can explain this outcome a little bit more in detail if you like. Lastly, Professor Guckert and I do want to provide you with an opportunity to mentor a junior colleague. As I mentioned, it is our professional responsibility to contribute to the education of others. And I do want you to realize that you have a huge impact on the attitudes and behaviors of your junior colleagues. I do know that my first-year students try to mirror the professional behaviors of the second-year class or third or fourth-year class. So thank you so much for serving as an example and participating in the activity. So the first-year students are asked to print off the certificate of attendance, and they will ask for your signature before they leave. This is to verify that the student did show up for the visit. And I need this in order to give them a mark for the self-reflection. I want to make sure they did participate in the site visit. I also want to emphasize, if you find that there's any breaches of professionalism that includes dress code, please email me ASAP or call me on my cell. There's zero tolerance for unprofessional behavior. So I just want to say thank you once again, and if you have any questions or concerns prior to the students visiting you or after, please do not hesitate to contact me or Professor Guckert if you have any concerns or questions. Thank you and good luck, and I hope you enjoy this activity.